So I've got very good news that we don't have any further COVID cases in our state today. So that's excellent news. Just some stats on the Parafield cluster. So there are 29 cases linked to the cluster. And if people weren't up to date with the news yesterday, the two international travellers that we've had positive this week, we've added to the Parafield cluster. And the reason for this is that we received middle of the day yesterday, the genomic information about those particular cases. What this showed was that they had the same strain of COVID as the Parafield cluster. They were in the Peppers Hotel, so that immediately let us bring the conclusion that those people had indeed contracted that, not from coming overseas, but actually during their stay in the Peppers Hotel. So that's why it's now 29 cases linked to the cluster. We still have one person hospitalised. It's a woman in her 50s, but I'm pleased to say that she's stable. My team are continuing to do a huge job in terms of the monitoring and quarantining of close contacts and also contacts of close contacts. And there's 4,300 people in quarantine who are being contacted and also having regular testing. So in terms of our case and testing statistics, there are now 38 active cases in the state with a total of 557. And I was really pleased with the test results yesterday. 9,403, both including our public and private laboratories. So thank you very much for everybody who felt a little unwell yesterday and went out and got tested. And I'm hoping that you had a quick turnaround and you had your SMS back very quickly to give you that negative result. Now, people are very interested, and the press are very interested to know what we have learned by looking at the CCTV footage. And of course, in addition to the CCTV footage, we've had to go through detailed staff lists and roster lists to see who was where at particular times. And so that's a lot of information to get through. So my senior communicable disease doctors, who are expert in infection control, have had an initial look at the still photographs of the CCTV. So that's just the still shots. And they need to do a much more thorough review of the whole video sequence, and that will be happening over the next couple of days. But on the basis of the stills, I can absolutely confirm that nobody was in the wrong place at the wrong time, and I think that is the most important thing. But there are subtle details that they are looking at. They're looking at whether people had touched their mask, for example. When did they touch their mask? When did they touch another surface? So you can imagine it's very, very detailed information that they're needing to have a look at. But what is really clear was that there's no significant breaches identified which would have contributed to the, which we could have said, yes, that's definitely how it was transmitted. So it's much more subtle than that. I also just wanted to make people aware that we now are fairly clear that the index case, the first person, the first staff member that was infected at the hotel is one of the security guards and not the cleaner. And we can tell that by knowing who was on what floor at what time. There was also absolutely no incidences of staff going into people's rooms, into the travellers' rooms. And certainly no inappropriate behaviour at all. All staff have worked in those hotels, really doing the absolute utmost and really working to a very high standard. And I think for me, that is extremely reassuring. So at this stage, we will have some hypotheses, working hypotheses about how we think both that initial security guard and then the couple who were the travellers in a room became infected. But we may never be able to say 100% because, of course, we're reliant on going back to the history and looking at that footage. But the important thing is we will be able to have more information about how we can make this not only safer for travellers in the quarantine hotel, but also for staff working in those facilities. And I think we are in a very good position because we've had that CCTV at the Peppers. We've been able to follow all of those things through.